Yesterday, the UAE had its first case of a coronavirus sufferer being cured. We're here today at Asta Hospital in Al Qusais to find out how the virus can be cured, what treatments can be taken, and what preventative measures we can take to look after ourselves. A lot of people are thinking that the coronavirus is something that's very severe and lethal in all cases, but that's not true, is it?
Yeah, that's not true. Actually, coronavirus is like any other, respiratory virus. Coronavirus group actually causes normal cold, flu in human beings. But this novel coronavirus which has come is a different one from the animals. We're suspecting it's from the animals. The source is not completely traced yet, and probably it's a mutant coronavirus. That's why it is more virulent in human beings. Okay, so not all people get very sick. Most of, like whatever were the statistics we have of the epidemic going in China, we can see that like a small proportion of the patients are getting sick. That means if you are healthy, it may just pass off as a normal cough, cold or mild fever. But because of the number of deaths we are seeing and the level of infectivity of the virus, we need to be really careful. Now, regarding the case which got cured recently, which has been in news, there is no treatment as such for the virus. It is only supportive treatment. So body's immune system itself cures the virus completely out of the body. So it must have been a milder version of it. Okay, and if it's severe, definitely the patient requires hospitalization and treatment for other associated complications. Like suppose the patient develops pneumonia, there is a dip in oxygen level, you need to supplement oxygen. Maybe there is another secondary bacterial infection happening, so you need to treat with antibiotic. But for the virus as such, there is no antidote presently, and the WHO and people are working on it. So probably in the future, maybe we can have something.
I've seen a statistic that says like only 1 in 4 of these cases are severe. Is that?
It's quite deceptive because this is all based on the numbers that are coming out. So presently like around 34,000 plus people are infected. Out of that, you can see that 800 plus have died. So if you take a proportion of that, probably the fatality is like around 2%. It's all calculation, like more needs to come out to have a real figure. But it's very difficult to say how many are severe, moderate or mild, because